happy to be here with you all today. Today we will be discussing about insulin requirements in women. Hello, hi Dr. Ishita, how are you?
Hi. Good evening. Good. थोड़ा late हो गया. I was having some
No
network
worries.
issues, so I had
It's
to restart.
okay, no worries. I hope
Oh,
everything is fine.
yes.
Perfect,
How
perfect. Thank
is
you,
everyone doing? Hello.
thank you so much for coming live with us once again.
My pleasure. I enjoy our conversations. It's so much fun.
Honestly, it's really fun with you always. Okay, so I was just telling
Thank
the
you.
audience that today we will be talking about insulin requirements in women and why do
Yes.
women need more dosage or maybe less dosage than man, which we'll today figure out with
Hmm.
Dr. Ishita.
Okay, let's go.
Perfect. Okay, so the first question for the live session will be why do women often require different insulin dosages than the man?
Okay, so there is an element of insulin resistance which is slightly higher in women than men. So ultimately, whether it's diabetes, you will have insulin resistance plus insulin deficiency, right? So if your resistance is higher or your deficiency is higher, either way, you will need more amount of insulin.
Okay. Okay, so how does the dosages actually differ from that of men? Like, do they differ from when, is there a difference between men and women in the, dosage intake?
So the dosages will be determined by the type of insulin deficiency that they have. You
Okay,
know, whether it's a basal insulin deficiency or post-meal. So according to that, the dosages are adjusted. And because they have a slightly higher amount of insulin resistance, and also estrogen increases insulin resistance. So your overall dosaging will be higher. But obviously, a lot of it also depends on your lifestyle, your habits, your eating patterns. So, yes,
absolutely. That's something, that is very much required for every type of disease, I think. Okay, so,
correct. True.
okay, moving ahead, how do factors like weight, body composition, and metabolism influence insulin requirements in women?
Okay. So, right from menarche to menopause, women go through like a lot of hormonal transitions, right? Every month you have your periods, your hormones fluctuate high and low, and there are a lot of psychological stressful factors. Understanding also that your body gets tired far more easily than men.
Hmm.
I mean, I'm just saying a generalization of health status for those people who don't work out. There may be women who are fitter and having more stamina than men, but yeah, um, all of those factors do play a role. And during periods, you feel more tired. Your PMS phase is there where your hormones are going low. So all those things will definitely affect your your dosaging of your insulin. Dosages will be affected by your up and down.
Yeah.
You feel more tired, you'll tend to eat more, or you'll not tend to eat at all. You just want to come home and crash. So those things will affect your dosages. Also, like the current heat wave that is going on, we've seen so many patients eat very little food. So we've had to reduce their dosages now. So just make sure that, especially in summers, if you are someone who's on insulin, that you stay hydrated. Dehydration is far more riskier in anyone with diabetes. They have more risks of complications.
Okay, got it. And like we were talking about the periods and the menstruation cycle, right? So,
Mhm.
how do hormonal fluctuations during the menstrual cycle affect the insulin sensitivity and the requirements in women?
Okay. So, because of the fluctuation, no, your sugar levels will also fluctuate at that point of
Yeah.
time. Uh, so estrogen increases insulin resistance, but when you are low in mood, you may tend to eat more dopamine-inducing foods like maybe having a bowl of chocolate, or whatever, wafers, chips, all those things. We all have our own comfort food zones, which is fine. And you know that once in a month, it is like that time that you're like, no, doesn't matter. I'll see what I want to do tomorrow. Now I want to eat, I want to eat. So even in anyone living with diabetes, it does happen. So if you're eating something sweet, obviously your sugar will spike and you need to give a bolus accordingly and handle other things. Or maybe have fiber and protein before you have your piece of chocolate or, half a brownie or something like that. Um, yeah, I think the low mood increases your stress levels and tension. So, if your mood is negatively affected and you're tending to overthink, so at that point of time, your insulin requirement might actually go up.
Okay. Okay, got it. And what changes in insulin sensitivity occur during pregnancy, and how do they, impact the insulin management?
So, during pregnancy, it's an insulin resistant state. So, insulin resistance goes up.
Okay.
So, so obviously your insulin requirement is more, which is usually managed by your body. But if you are someone who is a
Hmm.
diabetic, during pregnancy, only and only insulin is safe.
Okay.
So that you have to be, if you have diabetes, okay, now there are two types of diabetes in pregnancy. One is a pregnancy induced diabetes, which is known as gestational diabetes mellitus. And for some people who are already uh, on
Diabetes.
oral medication, who are already diabetic women and they want to conceive. So before they want to conceive, we already put them on insulin and we manage them, and then we with the good sugar levels and that also during pregnancy your targets are different
Yeah.
than for normal people. So once we've achieved that, then insulin resistance state, and that is why you keep checking every few days, in fact. But also it might be every alternate day also in certain cases. But when you're stable, and particularly if it's a second pregnancy, it goes a little more easy because they also know how to handle themselves. Because when it's first time, it's new, it's scary.
Hmm.
And obviously, the second type is when you get diabetes during pregnancy, which previously did not exist.
Hmm.
So then, of course, your insulin dosages increase till the third trimester,
Okay.
and then after you've delivered, it might just come down.
Okay.
So then, obviously, after you deliver, probably a lot of patients actually stop insulin for a few days, and then when the sugars start going high again, then we start incorporating small dosages.
Okay. Okay. Got it. So
So,
does it have an impact on any, health of like giving more insulin? Does it have an effect on the baby?
no. In
Okay.
fact, why insulin is only allowed during pregnancy, because insulin does not cross the placental barrier. It does not reach the baby because
Okay. Okay.
insulin is something that our body produces. When it produces
Hmm.
less insulin, that is when you become a diabetic and we have to give you insulin from outside.
Yeah.
Correct?
Yeah.
But so it so the insulin that you get in the market is designed exactly like the way the human insulin works.
Okay. Okay.
That is why it is the safest thing for the baby and the mother during pregnancy and breastfeeding.
Absolutely, absolutely. Okay, and how can are there any strategies to manage the insulin requirements during menopause when the hormones level fluctuate?
Yeah. So again, there will be again, like menopause is also a very difficult time for a woman. There's a lot of hot flushes. Sometimes you don't understand what is going on. The best thing would be if you incorporate weight training at a very young age.
Okay.
Weight training, training will help you keep a relatively stable level of health
Hmm.
and blood sugar management. And most importantly, it might mitigate the effects of menopause. Mitigate, थोड़ा कम करेगा,
Hmm.
पूरा कभी नहीं जाएगा, because those are still massive hormonal changes happening within the body, sudden hot flushes, all of that. तो वो सब होगा, लेकिन थोड़ा सा कम होगा. And because you're already resistance training,
Hmm.
your overall health will be far better.
Okay, okay. That's really nice to hear because nowadays every other person is in the gym, right? So it's nice to hear
Uh-huh.
that weight can help somewhere.
Yeah,
Okay.
absolutely. In fact, I'll tell you, the body is so amazing. It's like a full magic chemical factory.
Hmm.
We have so many patients who have gone off of their uh, depression medications after starting weight training.
Yeah.
And every time a patient comes with that success story, it's like in your head, I mean, obviously you can't jump up and down in the clinic, but it's very something small, but I mean, it feels so good that the patient followed your advice and is doing so much better in their life. I mean, that's what you could crave for at the end of the day. So,
Absolutely.
weight
Absolutely.
training, weight training, weight training, especially if you're a woman, it also, um, I'm not being partial, but your bone health,
Hmm.
like you said during menopause, your bone health will also improve if you start weight training at a young age.
Okay. Okay. Wonderful.
Lesser chances of osteopenia, osteoporosis.
Okay. Okay. Got it.
Mm.
Okay. And why are there frequent, blood glucose checks important for women managing insulin, which we have already talked about a lot, right, in the
Huh.
session?
Yeah. See, the only difference between men and women frequency would be, again, during your periods, your blood sugars, your moods can fluctuate. You might get irritable and all of that. So sometimes it can be going into hypos also. You might be going into low sugars also, you know, because, you're in that pain and then you don't feel like eating. And then you're like, oh, I took the insulin in the morning. Now I'm not eating anything. फिर low sugar, फिर तब तब खाओ, फिर high sugar. So keep your meals balanced, and even if you don't feel like eating, eat something like a small fruit or something that is protein full, or just a paneer roll or an egg roll or whatever, depending on your dietary preferences. Just have thoda sa na.
थोड़ा थोड़ा करते ज्यादा हो जाता है ना.
You That is also another very interesting thing that you said. थोड़ा थोड़ा करके ज्यादा हो जाता है. But do you know the stomach is the most versatile um, organ of the body? You you eat 3 chapatis every day. You will feel hungry if you eat two. Correct? Now you eat 2 chapatis for 15 days. You'll say नहीं यार 2 काफी है.
Exactly.
Then you can reduce it further. But then now if you still are hungry, you can incorporate fiber like a salad or a probiotic like your curd and fill up your stomach, and reduce carbs thoda sa. That will also dietary wise also help reduce insulin resistance, having a good amount of protein and fiber in your diet.
Absolutely. Okay, moving ahead. What role does consistent monitoring play in adjusting the insulin doses based
Huh.
on the hormonal change?
So obviously, if your blood sugars are very high continuously, it's going to damage each and every organ of the body,
Yeah.
right? So we don't want that is why regular blood sugar tests are important. Now, the second thing that you asked me was the if it goes into low sugars, then that's when it happens that you're going into low sugars, you're not checking, but you're eating because you want to counteract the low blood sugar, and then you start putting on weight. Then you're like, doctor, my sugar is going low, then how come I'm putting on weight?
Yeah.
So that happens because it's going low so often that you're eating more to compensate for that low sugar.
Yeah.
That's how you end up gaining weight. So that is why it is important whether if you don't want it high, if you don't want it low, also for sure.
Okay, so the last question of the session is how can women effectively, convey their hormonal fluctuations impact to a healthcare provider or to their doctors?
Sorry, can you repeat the question? A little voice got
Oh,
cut.
is it fine now?
Yeah.
Okay, okay, perfect. So how can, women effectively convey their fluctuations or the hormonal changes to their healthcare providers?
You have to be very honest about things. Most people, when they come to the clinic, they don't want to admit that they're not feeling great. No, I'm okay. No, I'm okay.
Yeah,
Then their relatives are like, they look at, they're like, no, you're not okay. Please tell the doctor what's happening. Um, so that's very important to whatever it is. You tell them if you're not able to sleep well, if you're not able to eat well, if you're not able to, get anxiety and panic attacks. Again, if you are an anxious or panicky sort of person, your blood sugars will increase. So then there are ways to counteract that also, you know, like deep breathing, meditation, again, strength training. So these are the ways you come out of it. Okay. See, we all have something or the other in life that bothers us, right?
Ab-
We all are dealing with something. But unless you don't talk about it, you're not honest about it, you will never find a solution to it.
Absolutely,
And
absolutely.
even if you know what the solution is,
Hmm.
you might still need a little nudge. Ki, you know what, you got this. Go, go, go for it.
Yeah,
I don't feel like walking. Well, nobody feels like working out. But it is after the workout that you feel great. So you're like, oh, no, no, no. Now I'm not stopping to work out. This is great.
absolutely, absolutely. So that
So
that's
yeah,
it.
that's the mindset shift
Yeah,
that you need.
absolutely, absolutely. So basically, even if it's the slightest problem that anybody is facing, they should go and tell to their doctors, right? Okay, perfect. Thank you
Correct.
so much. Thank you so much. That's
Uh-huh.
all for the session. Yeah.
My pleasure. But very importantly, especially if you're someone living with diabetes
Hmm.
and you get chest pain while walking, which is why also walking is very imperative, because if you're walking daily, you have a certain level of stamina and
Yeah.
fitness. Okay. Now, suddenly, if you start noticing chest pain one day or something like that, you get in touch with your doctor immediately. Why is this important? Because the moment you get in touch with your doctor or you tell them कि मुझे ऐसा तकलीफ हो रहा है, then they will evaluate you, because previously that was not existent. So you need to understand the difference also between the two,
Okay.
right?
Okay.
कि आपका मतलब पहले आपको कोई चेस्ट पेन नहीं होता था, कोई डिफिकल्टी नहीं होता था वॉकिंग करने में, एंड सडनली वन फाइन डे यू स्टार्ट फीलिंग चेस्ट पेन और heaviness. This is in any person, especially living with diabetes, is very, very, very important.
Okay. Okay. Got it. Okay, perfect. Guys, if we have any questions regarding the session, you can please shoot in the comment section and we'll get the answers from Dr. Ishita. I will just go through the comment section if there are any. Okay, I guess there are none.
Yeah. Actually, no questions today. I think very few women logged in. Maybe later we'll get it in the reel section. We'll get the questions.
Absolutely. In case, guys, if you have any questions, please feel free to drop in the reel section, or maybe we all will also put this live session on YouTube. You can also post your questions there, or maybe DM us with the same. We'll get the answers from Dr. Ishita. Thank you so much for being with us once again. It's a pleasure to be.
My pleasure. Always.
Okay, so
Okay.
before ending the session, I would just like to tell the audience that at THIP Media, we are dedicated to providing the health information which is from the reliable sources and our well-trusted doctors. We would request you to not go and Google anything and just trust anything that's on Google. Also, please follow Dr. Ishita and the Healthy Indian Project on Instagram. We also have a page on YouTube. We'll keep coming with more such lives, and we'll also keep coming with more lives with Dr. Ishita. Definitely.
That's really sweet. Thank
Okay,
you.
remember, when you know better, you live better. Thank you so much. Bye bye. Good night.
Absolutely true. Bye.